Hello and good evening to all. I welcome you to the exclusive Kidney Care Talk Show, an initiative by Integrated Health and Wellbeing Council powered by JB Chemicals and Pharmaceuticals. I'm Dr. Asavri Sawant, Public Health Specialist at IHW Council, and in this live show, we will discuss about diabetic nephropathy and glomerulonephritis. Approximately 40% of patients with diabetes mellitus develop diabetic nephropathy. Diabetic nephropathy is the single most common cause of end-stage renal failure worldwide and a major indication for dialysis and kidney transplantation. The exact cause of diabetic nephropathy remains unknown, but insulin resistance, genetics, hyperglycemia, and an autoimmune process are shown to be one of the biggest causes. Glomerulonephritis is also one condition that affects the kidneys. Hence, there is a wide need for generating awareness on both these topics, for which the aim of today's talk show is to impart expert guidance on diabetic nephropathy and glomerulonephritis, for which we have with us Dr. Abhishek Raman. Dr. Raman is an associate consultant of nephrology, kidney, urology institute at Medanta Hospital, Patna. Dr. Raman has a vast experience of hemodialysis, peritoneal dialysis, and has been part of more than 500 kidney transplants during training, including multiple ABO-incompatible kidney transplants. Dr. Abhishek specializes in glomerular diseases, hemodialysis, and kidney transplants, and has special interest in critical care nephrology and use of point-of-care ultrasound in nephrology and diabetic nephropathy. Sir, we welcome you to the show. Thank you so much for joining.
Thank you so much, ma'am. Thank you so much.
So as the topic of today is diabetic nephropathy and glomerulonephritis, and the aim of today's talk show is to impart public health awareness to non-medical professionals specifically, let us start by knowing what diabetic nephropathy is and what are the common signs and symptoms for it. Over to you.
Okay, so yes, we need to know about diabetic nephropathy because it is almost it is a non-communicable disease that is increasing at a very rapid rate and almost affecting all people who are diabetic. What is diabetic nephropathy? It is one of the complications of diabetes. As you know, diabetes is a disease that is affecting a large number of elderly population in India. And a lot of the number of times the diagnosis of diabetes is made a little late. So in that case, what happens is the diabetes starts affecting the vessels of our body, the blood vessels. And in that process, there are some, it affects the larger vessels. So there are some complications like cardiac diseases, getting a heart attack could be a result of diabetes, as well as the diabetes also affects the smaller vessels. So these smaller vessels can include the blood vessels of the kidneys. This results in dysfunction of the kidneys, leakage of protein from the kidneys, and would also results in deterioration of the kidneys. Okay. So because diabetes is such a common disease and almost and also increasing at a rapid rate, knowing about diabetic nephropathy is very important. So should we move on to what are the signs and symptoms of diabetes?
Yes, sir, please.
Okay, so obviously, if diabetes remains uncontrolled for a long period of time, people would develop, those patients will develop diabetic nephropathy. What are the signs of diabetic nephropathy? Increased frothy urine is a sign, usually not noticed nowadays because of the Western commodes. People don't tend to notice whether the urine is frothy or not. So we need all patients who have diabetes should get their urine tested from time to time and see if there is any evidence of protein leakage in the urine. Okay. The second thing that comes on usually very late is a late symptom where we would know that the diabetic nephropathy has already progressed quite a lot, is development of swelling of the feet, swelling around the eyes. These are the things that you might notice if you're a diabetic patient and have started getting diabetic nephropathy.
Thank you so much for explaining us those signs and symptoms. So I just wanted to know if diabetic nephropathy affects only those individuals whose diabetes is uncontrolled. If there are any other group of people also that might get,
No,
develop this
no. Diabetic
old
nephropathy only,
people.
yes, only is seen only in the diabetic population. And in fact, diabetic nephropathy has now become the most common cause of kidney disease in India and the world. Another thing that I would like to add in the signs and symptoms is once a patient gets diabetic nephropathy, usually the other smaller vessels that I was talking, blood vessels that I was talking about, they at the same time, they're also affecting small blood vessels of other areas. So, patient with diabetic nephropathy is has a very high likelihood of having an entity called diabetic retinopathy. And how does a diabetic retinopathy would usually present with a blurring of vision? Okay, so if a diabetic patient suddenly starts having blurred vision, then we should also suspect diabetic nephropathy along with diabetic retinopathy. If patients of diabetes start developing tingling of their lower limbs and of their hands, which is called sock and glove paresthesia, that would also mean that the smaller vessels are getting affected, and we should also look for diabetic nephropathy. It is a sign to the doctor that you should look for diabetic nephropathy.
So, sir, by what we mean uncontrolled diabetes, and for how long necessarily it usually is uncontrolled for somebody to develop this condition?
Yes, so that is a very good question. What we mean by uncontrolled diabetes? Having usually now the Endocrinology Society of America and all these different societies recommend that a patient of diabetes should have a HbA1c level of around 6.5 to 7 in younger population and around 7 to 7.5 in the older population. This level, if not reached, and if the level remains above 8, the HbA1c level remains above. What is HbA1c? HbA1c is a marker of your sugar control in the last 3 months. So if that remains above 8, those patients have a higher likelihood of getting diabetic nephropathy. What usually happens is when diabetes is detected in a patient, they have had it for uh, 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 an unknown period of time because the diagnosis has not been made on time. So usually they have had it for a number of years before their diagnosis. So usually some patients who present to you, present to the doctor with an initial complaint of diabetes, might already have diabetic nephropathy. So it needs to be evaluated at the first point when the doctor is met, whether the patient has diabetic nephropathy or not. The other thing is for how long have you had diabetes? Usually it takes, if a person has had diabetes for 5 years, that's when nephropathy starts developing, and if it's been uncontrolled.
So we can understand that adults of around 40s or 50s developing diabetic nephropathy, usually having type 2 diabetes. But if it does, this disease also can occur in type 1 diabetes and young adults or, adolescents, and in gestational diabetes cases, pregnant mothers who have developed diabetes. So can this diabetic nephropathy occur in these
Yes.
two as well?
Yes, yeah. It can definitely develop in patients who have had type 1 diabetes. But the good thing about patients with type 1 diabetes is that usually they're diagnosed very early. So if their blood sugars are controlled, their likelihood of getting diabetic nephropathy is very less. With gestational diabetes, if the gestational diabetes subsides after pregnancy, then there is less risk of getting diabetic nephropathy. However, there is a good risk of getting diabetes itself in patients who've got gestational diabetes. So they need to be aware of that, and they need to take steps to know that their diabetes, if they do develop diabetes, is caught early.
Thank you so much, sir, for explaining all those things. So we saw the signs and symptoms. We also saw the people who are at higher risk for developing this condition. And we also saw the early signs for identification. Apart from what you have mentioned, are there any other early signs that people can just see and notice that, yes, something is not normal over here and I should need to go and get checked with my doctor?
The first thing that needs to be that people need to be aware of is that if they have diabetes, they should know that they have a risk of developing diabetic nephropathy, and should get regular urine tests done in order to catch it early. We also need to prevent it. If there are patients with diabetes, we need to prevent the start of diabetic nephropathy. So we need, if they're hypertensive also, usually diabetics also develop hypertension. So we need to give them drugs that will delay the onset of diabetic nephropathy. Usually drugs like ACE inhibitors and ARBs are given to prevent diabetic nephropathy. And nowadays the advent of SGLT2 inhibitors like dapagliflozin and empagliflozin are given to prevent the onset of diabetic nephropathy, and delay progression of diabetic nephropathy as well.
Thank you so much, sir, for clearing that. Let us move on to methods of diagnosis. As you shared with us that getting your urine samples checked is one of the best ways. Are there any other methods of diagnosis that are also advised?
Once we actually have when we see that if there is any protein in patients with diabetes, we usually get it followed up with the quantification test, which is urinary albumin creatinine ratio or urinary protein creatinine ratio. And with that, we can quantify whether diabetes is whether the patient has microalbuminuria or macroalbuminuria. Obviously, we would whether or not the patient has microalbuminuria or macroalbuminuria, the treatment is usually the same. It's just that the progression of the more the proteinuria, the faster the progression of diabetic nephropathy, and the faster the deterioration of the kidneys in a diabetic patient.
So, sir, can you also please explain us what are the available methods of treatment for this condition and what is usually prescribed?
So as we've already mentioned, the first thing a patient would need to do in order to prevent diabetic nephropathy is to control their blood sugars. And there are various methods, including drugs, lifestyle changes, reduction of obesity, weight loss, that would prevent diabetic nephropathy. So the first thing that needs to be done is to control diabetes. The second thing that we need to prevent diabetic nephropathy from happening is drugs, which the doctors give. The first drug of choice would be ACE inhibitors and ARBs. The second thing second go-to drug, which has created a storm in the medical fraternity, and now everybody is getting those drugs, are SGLT2 inhibitors. So these drugs are very good in preventing diabetic nephropathy, and if diabetic nephropathy has already happened, then in delaying the progression of proteinuria.
Thank you so much, sir. So, sir, just wondering, if somebody is in mid-40s, mid-50s age group and has type 2 diabetes and has been detected of, early signs of diabetic nephropathy. So what are the lifestyle changes one should be adopting so as to come back to normal range? I would also wanted to request if other physical or lifestyle conditions, such as being in overweight or type 1 obese category, or having some sort of heart disease related conditions. So do these also add to the faster progression of diabetic nephropathy? So can you
No,
please...
What the ideal thing to do in terms of lifestyle changes um, is to change your dietary habits, and which would prevent, uh, which would which are usually taken up even for diabetes. Now, like those lifestyle changes, the dietary changes are supposed to be should be also include a low sodium diet, which would prevent hypertension, which can also damage the kidneys. So, a low sodium diet, along with decreased amount of simple sugars, um, and a limited amount of polysaccharides, would help in weight loss, and would in general lead to a better well-being of the patient. Uh, the other lifestyle change which is very important is physical activity. uh, Around a moderate intensity cardiovascular exercise like brisk walking for at least 30 minutes a day for at least 5 days a week is what is recommended for all patients with diabetes, or in general for the population on the whole, to maintain a healthy lifestyle. So that should be the lifestyle and dietary advice given to everyone, and that should be followed.
Thank you so much, sir. So, sir, also wanted to know if diabetic nephropathy is completely curable or treatable, and can the condition be reversed?
The condition can be, first of all, can be prevented with all the measures that we are taking. The second thing is that yes, it can be partially reversed. Once the proteinuria has occurred, if we control the hypertension, we control the blood sugars, we give ACE and ARBs, we can reverse it almost completely, and even prevent it from happening. So that's how it.
Thank you so much, sir. Let us move on to the next part of the discussion, talking about what glomerulonephritis is. So, can you please start with what it is and what are the signs and symptoms for this condition?
Okay, so glomerulonephritis is something that's a disease of the glomeruli. Glomeruli are part of the nephron, and which is the basic unit of the kidney. Each kidney is made up of almost 9 million nephrons. So glomerulonephritis usually occurs. It affects different age, different. It is actually not a particular disease. It is a group of diseases which affect the glomeruli. It can be usually it is immune mediated. It can also be hereditary. It can it can also uh, occur due to destruction of blood in the blood vessels. Okay, so the glomerulonephritis spectrum, the whole spectrum, you can occur at any age group. It is the third most common. It is the fourth most common cause of kidney disease in the population worldwide, and the most common glomerulonephritis is what we can talk about is IgA nephropathy. Okay. Now, what are the signs and symptoms of glomerulonephritis? Uh, Usually, the kidney-related signs and symptoms would include swelling of feet, usually in a young person who's non-diabetic, has not been diagnosed as a hypertensive before. Um, some patients would also complain of frothy urine. Some patients also complain of a dark tinge of urine, the change in color of the urine to a darker tinge, and development of new onset hypertension. Sometimes, if the glomerulonephritis is very severe and patients and develops in a very rapid rate, usually patients will start having a decreased urine output. So those are the striking signs and symptoms that one should look out for and must be aware of.
Sir, leading to decreased urine output. So, does it also cause inflammation or swelling into other parts of the body apart from legs?
See, it causes swelling of the legs, not because of inflammation. The inflammation is usually happening in the kidney itself. Now, because the kidneys start dysfunctioning, they're not functioning properly, it leads to retention of salt and water in the body, which then leads to swelling of the feet, swelling of the eye, around the eyes, and also an increased blood pressure because of retention of excess water that has been taken. So the swelling is because of the water retention that happens because of glomerulonephritis.
Thank you. So it is very alarming to note that this disease can affect anybody regardless of any age.
Yes.
And does not have to have any other underlying lifestyle diseases for it to occur.
Yes.
So any other diseases that or infections that person might contract, can that lead to developing glomerulonephritis as well?
There is an
Or is
entity,
it...
yes, there's an entity called infection-related glomerulonephritis, where very severe infection, usually someone who has a cellulitis, infection of the foot or the leg or lower limbs, if it persists for very long, can affect the kidneys and does not have a very good prognosis. So anyone who has had infection for very long and has not been treated appropriately can develop infection-related glomerulonephritis. In younger children, there is an entity called post-streptococcal glomerulonephritis, or nowadays even called post-infectious glomerulonephritis, which so post-streptococcal glomerulonephritis, which is caused after either a bout of pharyngitis, cough, or some skin infection, some skin streptococcal infection, and there's development of antibodies which affect the kidneys, usually develop 1 or 2 weeks after these bouts. Okay, and this infection, the post-streptococcal infection, has a very good prognosis. Usually, the patients recover completely without any medication and only supportive measures. However, if there are other infections, like infections of the feet, usually cellulitis, usually a gram-positive bacteria like Staphylococcus aureus, these don't have a very good prognosis. So, and even patients who have had infective endocarditis, like those patients, because the infection persists for long, can develop these diseases. The infection-related glomerulonephritis.
Thank you so much, sir.
Yes.
So we also wanted to know that in the probability of different age groups, which
Yeah.
age group has the highest chances of developing this condition usually?
Usually, IgA nephropathy normally presents. IgA nephropathy is the most common glomerulonephritis in India, and probably all over the world. So it has various different presentations, and sometimes remains asymptomatic, and the patient does not develop any kidney dysfunction. However, it can also present in different people in different ways, and in some patients it develops usually with there is rapid progression of renal failure, what we call RPRF, and the kidneys usually shut down within weeks of developing it. So it usually presents in the 20s and 30s. So you can say the third and the fourth decade of life is the common time of presentation. And the preponderance, whether it's genetic preponderance, whether it can happen to people, it can be transferred from one person to the other through generations, has not been seen. And it is also sort of an immune dysregulation. So your immune system is not regulated in a proper manner, which leads to this disease.
So can you also please clear out this query that we have, that if antimicrobial resistance could also lead to developing glomerulonephritis, as you were sharing that there are some pathogens that can cause antimicrobial resistance, and does somebody who has been taking antimicrobials for an extended period of time can in future
No,
develop this condition?
no, they usually don't develop glomerulonephritis. Antimicrobials, as a drug class, some of the antimicrobials can lead to kidney dysfunction, but not glomerulonephritis.
Thank you so much, sir. So let us now move on to talking about the existing methods of diagnosis and treatment that are available for this condition.
Okay, so glomerulonephritis, we can't talk about all of them one by one. Like I will give you a general picture of usually what kind of treatment we give, and what are the existing methods of diagnosis. The gold standard method of diagnosis of glomerulonephritis is kidney biopsy. Uh, and so there are many different diseases that can cause glomerulonephritis, usually autoimmune diseases. Most common is IgA nephropathy. The other one is systemic lupus erythematosus, what we call SLE. Then there are some infections which might cause glomerulonephritis in the long run. It's like hepatitis C, some chronic infections. So hepatitis C, hepatitis B, even HIV can cause glomerulonephritis. So if a patient comes to you with kidney dysfunction, and we need to rule out these diseases first. So first the infections, and if somebody who fits the criteria for maybe lupus erythematosus, we need to do an ANA, and then later dsDNA. These are blood tests which need to be done to rule out lupus erythematosus. IgA, usually there is no blood work that we can do to actually diagnose a patient with IgA nephropathy, but we can do for that we have to do a kidney biopsy. Now, as long as there are some other diseases as well, like TMA and C3 glomerulonephritis, which is also an entity. It is a rare entity, but seen usually in the elderly after 50 years of age, and associated with diseases like multiple myeloma. So we need to keep even that in mind in older patients who are coming to us with kidney dysfunction and in whom we suspect glomerulonephritis. Some tests that we need to do, which are important and can help us differentiate between different glomerulonephritis, are C3 and C4 levels. And there is an entity called immune glomerulonephritis, where the antibodies are actually not present in the kidney, but they lead to kidney dysfunction. And for that, we have a blood work, and it's called anti-PR3 and anti-MPO levels.
Thank you so much, sir, for giving us wealth of knowledge and information in this session. Last question for you would be, what are the latest advances in the detection or treatment of both these diseases that are under work in developed countries or in India that you would want to highlight, or could be in future a great boon for, avoiding or curing this sort of disease?
What would be your at the ending?
Yes, you were saying that just 1 second, sorry. Yes, sorry for the interruption.
Please go on, sir.
Yes, so the newer methods for diabetic nephropathy, we don't actually need newer methods now. We have HbA1c levels and urine protein creatinine ratio, and also we also have urine albumin creatinine ratio. So for detection of diabetic nephropathy, there's no newer method as such for diagnosis. And since we have known this disease for very long, we as doctors are aware of this situation developing, and we keep checking the patients for diabetic nephropathy. As far as glomerulonephritis is concerned, we need to the latest advances are these new blood works that I've already mentioned, and but there is a lot of scope for development of newer methods to detect glomerulonephritis, possibly at an earlier stage and possibly less invasive compared to kidney biopsy. So, but however, the research in this field as of now is lacking. And another thing that I would want to mention about the treatment of glomerulonephritis is usually is that now we are still holding on to older drugs like cyclophosphamide, and steroids, which have been given. The newer drugs that are upcoming, especially in conditions like ankylosing and in SLE, there are lots of newer drugs coming. Rituximab is one of them, and voclosporin in lupus nephritis, belimumab. So there's a lot of research happening in lupus nephritis and in ankylosing, and we're coming up with rituximab and other drugs also. So there are more drugs coming, possibly right now, not in India, but possibly very soon.
Thank you so much for sharing all those information, sir. That definitely gives us a ray of hope in the other space of nephritis that you have mentioned. Moving on to the last very question, what would be your advice to all the viewers that are watching to keep their kidneys healthy, as we are still at the last day of March, the month of kidney health awareness? So what would be your advice?
My advice would be to actually for patients who are elderly, to go for regular health checkups. If usually see, hypertension and diabetes are the most common cause of kidney disease at this point of time, and they're both lifestyle diseases. So maintain a healthy lifestyle, do a lot of cardiovascular exercises, get yourself checked once in a while for hypertension, because hypertension is a disease which has no symptoms, and diabetes is also a disease with very few symptoms. So get yourself checked from time to time. Lose weight if you're obese, and yes, I mean, avoid simple sugars for to stay healthy, and just keep a good healthy lifestyle, and yeah, go for walks, go for long walks, brisk walks, all this. Yeah.
Thank you so much, sir. Thank you so much, Dr. Abhishek Raman, for taking out time from your busy schedule for imparting us knowledge and wealth on this very important topic of diabetic nephropathy and glomerulonephritis. I am sure the viewers were made very aware on this topic and would do their bit as well to keep themselves and their kidneys healthy. I would also like to thank our partner, JB Chemicals and Pharmaceuticals, for partnering up with us on this initiative for generating kidney care awareness. With that, I would like to thank all our audience for staying with us till the very end. Thank you so much. This is me signing off for today. Thank you. Have a nice evening.
Thank you. Thank you.
Thank you.